I did my house.
That's good. You have to stay at home.
I did my house.
Okay, until 15 minutes now. So let's start. Everybody, please mute yourselves now. Let's start.
Kitchen.
Dr. Ola, are you ready?
Who can remind us of the topic of last week?
Larry, would I play music? Come play out of the tone that is going. So, Dr. Akiola, whenever you're ready, we are ready. I can share the slides if you want.
Wale Dari. I greet you, Wale Dari.
Okay, but you know that you mute everybody.
No, I didn't mute everybody.
Anyway, Kesha.
By the way, we are recording live.
Babies. Okay.
Let him mute you.
When are we starting?
Dr. Akiola, we are waiting.
Where is our doctor? Day one.
Maybe I should take the class.
Dr. Akiola, we can't hear your voice, so. Yes, Baba. Well, Andrew, about you. Oh, no, and this one is the one from you. It has your name on it. Okay. Okay, I'll stop the share then. But we can't hear your voice from on the Zoom call, though. Let me, you need to unmute your computer because you're muted right now. Mi rò pé ṣé kọ̀ǹpútà Tolú ò ní microphone ni? People, I don't think people can hear you on the call, though, on the Zoom call. So that means you have a speaker. Are you using a desktop computer or a laptop? I'm using a laptop. So that means that your microphone is probably not activated. Oh, Jesus. That's your speaker. You can hear us because your speaker is active. But for us to hear you, your mic has to be active. So if you go to, well, on the Zoom window, that place on the Zoom window, like at the bottom, you see the control panel. The part that says mute. If you click on the arrow beside mute, I want you to please click on test speaker microphone. Or at the very top. So when you click on the arrow beside mute, at the very top, which microphone do you see there? It says select a microphone. On it. Do you see save as system? So let's select save as system and let's see. Hello. Okay, your voice is still not coming. Your voice is still not coming through. Microphone was selected. I can hear you on my cell phone, but people cannot hear you on the call, on the Zoom call. No, speaker call, microphone part, and issue. So you can try to. So when you select that, what happens? No, the people cannot hear you. Choose another microphone then. Is there another microphone apart from same system? Yes. No. It's not coming from the Zoom call either. Try another one. That is if you call into a Zoom call with your cell phone. That's when you use that. But or do you want to call into the meeting with your cell phone? That may be a better option. Yes, what I'll do is, let me share, let me, okay. Let me, let me check the international numbers that you're going to, the international number part. Oh, Jesus.
Hello, Joe.
Yeah.
Please, sọ fún Tolu kó lo phone ẹ̀ to join through the phone for speaker to speak and use the laptop to display slides.
Yeah, that's what I'm trying to figure out now.
Okay.
Shit, I don't see any number for international callers. This is a mess.
He could not connect his laptop.
I'm an idea when I've been
Five, no, I'm close every day. I'm school. Mark, like, is the coordinator, the person in charge that put in this market. Okay. This is 4:30. Yes. You want to go?
Okay. Hold on.
Don't give it.
Hey, Gemma Bino, give me a second. I want to try something. I think I may be able.
You have not entered any numbers. Please re-enter your meeting ID followed by pound.
Yeah, sir. Sir. Okay, sir. Okay, no problem, sir. Me, Koruko, sir. Yes, yes.
Hey, Gemma Bino, I'm very sorry about this. Let me try one more thing.
Welcome to Zoom. Enter your meeting ID followed by pound.
176.
Your participant ID followed by pound. Other are in the meeting now. There are 17 participants in the meeting.
Olabisi Makinde.
Joshua and Bomio.
Yes, yes.
Okay.
No,
Now, hold on. Let me ask. So what I'm going to do, I'm speaking through my cell phone. Let me Okay. Anyway, so I don't know what we're going to do, man. I can't get Tolu's voice in.
Why can't you, the suggestion at the chat something? Try that suggestion.
He can't let us pray. Okay, hold on.
Let Tolu join with phone and at the same time with the laptop. The phone will serve.
Yeah. So he cannot join by phone, I don't think, because I didn't set this meeting up for international numbers to call for some reason.
Okay.
I don't know. Yeah, it's only like, let me show you my screen. I don't know if it will allow any other. So these are the numbers that he can use to, okay, share more. These are the numbers you could have called through, but there's no number for Nigeria there or for Africa. Go back.
No, do you get what I'm trying to say? The same thing through Zoom. I tried, I experimented with this thing last week, and it worked. I used both my phone and my laptop. You get it? And the two connected. So, yes, the two connected.
Are you in Nigeria?
Yes, I'm in Nigeria now.
Okay, so that means that this number will work. Do you remember which number you called? Is it the New York one?
No, it's not that I didn't call any number.
He joined with two devices.
Oh, you click the link on your cell phone.
Yes.
Okay. That is true. So let me call you. This is true. Let's see.
MC coordinator. So they join call out to the cell phone directly. If you talk about the group here, if you go to the group and you tap on the link, you tap on the link that Kule shared. Oh really? So can you? You can still share your laptop and then you can speak through your cell phone. I think I see you. Show what the Faith Lois Akinyolabi.
Yes.
Okay, so your cell phone is trying to connect the audio. So I'm going to cut this call. Try and because it's not picking up the audio of your cell phone right now. I think it's because you and I are talking. So I'll drop the call. Yes, and so if you load the screen, you need to unmute that cell phone, the Zoom call on that cell phone. You need to unmute it. Because I saw you just on your wife's cell phone. Okay, I see you guys on your wife's cell phone, but then the voice is not coming through. So, now, but I can see your wife, and I can see you guys on the call. But voice, you, let me unmute. Hello? Voice, Wallery, Follery. I'm hearing you on my cell phone. I'm not hearing you on the computer, but that's on my cell phone. I need to hear you on my laptop. Yes. Abi, share everybody. Share and bottle unit. Abi, me Nicolo affect.
I can't hear him.
I can't.
Okay, so Lori phone, you're aware. Go to the Zoom window to open. You have to unmute. You have to tap unmute. Yes. One of the icons on the Zoom window on that cell phone.
Oh, you should be able to unmute him now. You know the phone.
I can unmute him via Zoom, but if the device is muted, I won't be able to. It won't work. It's not muted. It's not muted right now here.
Okay, can he hear us now?
Can you? Yes.
Yeah, please end down.
We can hear you now. Thank God.
Okay.
Yeah, okay.
How do we share?
So now you can share your screen back, the slides. I might be show you the bastard. You can't won't be like they are TV that don't encourage me give a show you that row. So I know that would be to
Hello, everybody. Can you hear me now?
Yeah, thanks. I can hear you. Yeah. Thanks, Scholar Wale, for the brilliant idea.
Sorry for the delay.
No, wahala.
So now, Dr. Tolu, you can now share the slides on your computer. So you'll be using the two devices.
Just a moment with that.
He's whipped it straight into the box. He's not any games.
I'm not accustomed to this, so I don't know how.
I don't play Lambaja nothing for you. And I can't play Lambaja nothing for you. Oh, I'm Aristo. Yeah, I'm Aristo. And if I even get to. Oh, Dr. Tolu, I can be sharing the slides here, and then you can just run through.
Share the slide for him.
I don't have the slides. The one I have is the one he had for last week, and I think he has changed it.
Okay.
Dr. Tolu, you can send the new slide to me. I can share it as long as we have your voice and you are seeing what we're doing. You'll be able to.
Okay. And then you should go ahead. Thank you very much.
No,
he said he has shared that.
If you send it now, the one I have is the old one.
I like the boys in particular. This in particular.
Dr. Jimmy, will I say you want to take music as a second career?
Okay. Middle age, 45 to 64.
Dr. Tolu, can you? Oh, anyway.
So be sharing them. I shared them. Because there's common ailment.
Hello.
This life.
Dr.
Just be using the ones here to talk.
No.
Now you can go ahead, please. I'm reading this list.
No, I didn't.
Hello, Juan.
Yes, we can hear you.
Okay. You have the slides now, Abi?
Did you email it to me now?
Oh, you don't do that. Yes.
Okay, let me.
Hello, Juan.
Yes.
You have the slides now.
No, I'm waiting for it. It's still flying over the Atlantic Ocean. Wow.
You work with me now, so that woman must be my own. I know now. You work with me when so
and that's one let go. Maybe you should send it to me. You send that other me.
More refresh every second. Never enter.
Enter.
Email answer.
Your mind is dirty.
WhatsApp, WhatsApp, lose send.
Your mind is dirty.
Email with the talk.
Some of us are pastors.
Hello. Báwo ni? We are fine and feeling cool. Mo sáré wá sí campus but àwọn èèyàn mi wà ní. Red and Caliber.
Juwan?
Yes.
Hello, Juwan?
Yes.
No problem.
Hello, Juwan?
Yes.
Àwọn dájú nǹkan, please.
Hello, Juwan?
Ṣé
Hello, Juwan?
Please, somebody did just flash me so that I want to greet him. I learned that I
Hello,
came to
Juwan?
visit us.
Hold on, doctor.
And I'm very sorry.
Hello, Juwan?
Yes. Dr. T, I can hear you, but I didn't get your email.
Hello, Juwan?
Yes. I can hear you. Can you hear me?
We are going to have serious problems.
Hello. I need that to say incident report. That is CEO to my query. Already I did my query. Dr. Tolu, can you hear me?
Ẹ jẹ́ kí Jimmy take over kìíní. even tó bá take over pẹ̀lú bóyá communicate pẹ̀lú Jùwọ́n ẹ̀, it takes time. Kọ́lọ̀ ẹ̀ tó dé ọ̀dọ̀ wa.
Hello, Jùwọ́n.
Yes, I can hear you.
Kí ni email address ẹ?
adejuwonanjorin@gmail.com. You sent me an email this week.
Ìyẹn náà gùn, ìyẹn lè ṣe mistake. Ìyẹn náà gùn. O ṣe wá nǹkan tó kéré tó fi kó fi sí adejuwonanjorin. Kí ló dé @gmail.com.
Go to the adejuwonanjorin@gmail.com ni.
Okay. Okay. All right.
Like play, we don't waste 1 hour. Shit.
But you can even share the presentation via WhatsApp now.
You've done that.
I've done that.
I've
sent it to your WhatsApp now.
Oh,
but that one is easier now.
I didn't know. I was expecting the email. Sorry, I didn't know it was on WhatsApp.
This is all right.
It's the same one I have now. Oh, this is the first time.
Otiri.
Okay, can I go on now? Can everybody hear me now?
Yes.
I can hear you. I can hear you.
Okay.
Just give me 1 minute to put this on my computer. Sure.
Hello?
Hello?
Hello, I can hear you.
Can everybody hear now?
Very well, clearly.
Okay, so can I start?
Sure.
Okay, sorry for the big delay, everybody. I copiously apologize for that. So I'll be presenting a continuation of common ailments in the 40s. Dr. Jimmy presented hypertension, diabetes, and ocular problems the other time. But let me just go to the main issue. I wrote there that of the 40s, whether male or female could either be referred to as young, depending on if you are less than 45 years, or middle age, if you are between 45 and 49 years. Now, those are some of the topics on the third slide, some of the topics we intended to discuss with the whole house. And on the fifth slide, please, I will try to be as fast as possible. Why are we focusing on the 40s? Most members of this group are in their 40s. And you know that the people between 40 and 49 years of age are significant parts of the economic workforce. We are mostly parents, taking care of our aging parents, and also our growing children, of course, together with our spouses. So we are also burdened with career pursuits and developments, and also meeting of establishment of set targets. Also, there is desire to meet career, societal, and religious expectations. All this may shift our attention from focusing on our health. I want you to ask yourself this question. How often do you service your car, the engine, the gear, the brake, and the steering in a year? Then compare it with how many times you've gone for medical checkup in the last 1 year. Now let's talk about hypertension. Hypertension is defined as a persistently elevated blood pressure, more than 140/90 millimeters of mercury, usually taken on 2 occasions. Some people say it's between 4 to 6 hours apart. About the prevalence of hypertension, it affects 60 million Americans and about 1 billion people worldwide. and it is the most common, readily identifiable, reversible risk factor for conditions like myocardial infarction, stroke, heart failure, atrial fibrillation, and some other disease conditions. Because of the escalating occurrence of obesity and the aging population in both developed and developing countries, the global burden of hypertension has actually risen. And it is projected that in the next 5 years, 1.5 billion people will be affected by hypertension. Hypertension before the age of 50 tends to be lower in women than in men because of the effect of estrogen. But after menopause, the prevalence increases. Eventually, by the age 75, which is below the average lifespan of people in US, about 90% will have hypertension. And hypertension has been known to be the leading cause of death worldwide and one of the world's great public health problems. The slide 11 just shows us the geographical variation of hypertension prevalence. And you can see Nigeria compared with people from other nations of the world. Talking about the prevalence of hypertension in Nigeria, 20.8 million cases of hypertension have been recorded in Nigeria in people over 20 years of age, with a prevalence of 28%. Some people have quoted other values. In fact, blood pressure of 140/90 millimeter of mercury, we have about 20%, 17 to 20% prevalence in urban compared to people living in rural areas. Also, when you talk about prevalence of hypertension among people of varying socioeconomic status, it is high in poor and it's so high among the rich people. Obesity, physical inactivity, and smoking in early middle age is a significant risk factor to developing hypertension. It will interest you to know that out of those people that are hypertensive, only 1/3 are aware. And out of those only 1/3, 2/3 are on treatment. Next is the classification of hypertension. I have a chart there like a table, attention. And at what time, at what point you say somebody is hypertensive, I want you to look at JNC7, which is actually Joint National Committee. You have stage 1 and stage 2 there. And you can see systolic blood pressure of 120 to 139, and diastolic blood pressure of 80 to 89, that is hypertension. Now, what are the risk factors for developing hypertension? It could be things that you cannot do anything about, which we refer to as non-modifiable, which includes your age. As somebody is aging, the risk of hypertension increases. Hypertension also runs in some families. It's common among the blacks, and like I've said, it's common among males, especially after the age of menopause in women. There are some other factors that you can modify, that you can do something about. For example, you can change your lifestyle, you can change your dietary factors, you can decide to moderate your alcohol, stop smoking, and other psychosocial factors. High salt intake have been noted to be a factor for development of hypertension, just like obesity. Hypertension is also likely among people who are diabetics. Of course, physical inactivity is also a risk factor. Intake among individuals is also a risk factor. It is said that the vegetarians are less likely to develop hypertension compared to the carnivores the omnivores, those people that eat all manners of food. People with history of low birth weight also are at risk of developing hypertension. The next slide, you will discover that there are many conditions that are associated with hypertension. Hypertension is found in so many disease conditions, and it is associated with chronic kidney disease, diabetes, peripheral arterial disorders, coronary heart disorders, congestive heart failure, metabolic syndrome, and stroke. You see a pie chart that actually shows a correlation between these different disease conditions, diabetes and lipid profile disorders. Now, how do you as an individual detect whether you are hypertensive or not? This is very, very important for everyone on this forum. When you want to take your blood pressure, it is better to take it early in the morning when you have had a good rest overnight, when you have not taken anything, you are not on coffee, you have not smoked, taking cigarettes, when you are comfortable, you are not having any pain, your bladder is not full. Of course, you must use an appropriately sized cup, and it's better to check it in both arms. Now, there is a chart that shows us some of these things that I've highlighted. Now, what are the symptoms of hypertension? Everyone on this forum must know this. I think our aim is actually to make people to identify or detect whether they have hypertension or not. If they have, to pick it on time. It really interests you to know that most people that are hypertensive are actually without symptoms. Most people that go on the road are hypertensive without knowing why, because they have not taken time to check their blood pressure. Where there are symptoms, you could have, the individual could have recurrent headache. An individual may have difficulty either with initiating sleep or waking up from sleep on time. Of course, there are other symptoms that could be due to end organ damage as a result of hypertension. People could have blurring of vision, eye aches. In fact, if it's not well controlled, it could.
Okay.
Did we lose Tolu? I can't hear him. Oh.
Sorry, I can't hear Tolu again. No.
Me neither.
Okay.
Dr. Jubi, can you stand in before he gets back?
Yeah, but
Hello, can you hear me?
Yes.
Oh, great.
We lost you for like 2 minutes, but you're back now.
Okay. So other symptoms of hypertension, it could also affect the heart. And when it affects the heart, the individual presents with easy fatigability. And the person could also have tiredness and have difficulty with breathing, either with little exertion or without exertion. Of course, it could affect the genitals, leading to erectile dysfunction, inability to have a satisfactory erection. It could affect the kidneys, leading to occurrence of facial or leg swelling. So an individual also could present with fraudiness, passage of fraudy urine. When it affects the nervous system, it could range from numbness to feeling of peppery sensations in the extremities. Now, how do we classify hypertension? We could classify it into essential hypertension which is also called primary hypertension or idiopathic hypertension. And that is commoner in about 80 to 95% of cases. While the secondary hypertension is as a result of some underlying disease conditions, be it renal, endocrine, and hematological conditions. Of course, from that slide, you can see the renal causes. You can see the renovascular causes. That means vascular disorders of the kidneys, and also adrenal glands. Adrenal glands are just above the kidney. Some other conditions like aortic coarctations, obstructive sleep apnea, and some other disease condition which I would not want us to be bothered about. People that take steroids could also develop secondary hypertension. Now let's go to management of hypertension. But this section today is not actually to make every one of us to be able to treat hypertension, but to be able to control hypertension. And for those who had hypertension, to be able to treat it appropriately. So there is a need for us to take a clinical and family history. We know that hypertension runs in some families. We need to do full physical examinations to identify the secondary causes where present and to determine the presence of end organ damage. Now, there are some tests that is expected that people who are hypertensive should undergo. We talk about electrocardiogram, which is popularly called ECG. This tells or ascertains the electrical activity of the heart. And there are many conditions that could be picked from ECG, ranging from electrolyte derangement to signs of myocardial infarctions or myocardial ischemia, enlargement of the heart, and so on. Also from urine tests.
Don't know. Authority. He can't hear it. Hello, Shadow. Well, what your hypertension? I think we lost the gentleman for a minute. We need internet in Nigeria, I swear, everywhere. Boemo, we lost you. Yeah, we lost you we lost you from when you were talking about the electrocardiogram. That's why we couldn't hear you anymore, yeah. We can't hear you now.
All right. Yeah.
Hello.
I think he's back now. He's back now.
Olójoro ni ẹ o. Olójoro ni ẹ
Hello.
Juwon Olójoro ni ẹ o.
Hello, need paracetamol.
You left your NSC gang since
Are we
you
here
don't
now?
move to Bukola Gang.
Ìgbà tó ti gbọ́ pé ọtí lè fa hypertension gbẹ̀yìn ló ti mú wọn.
It's not fair. That's
you left to gate. You left to gate. You left all of them.
Okay, let's go back. Let's go.
The lecturer is back.
Back. Everybody is talking.
Okay, Dr.
I'm back.
Dr. Akinola, the truth is bitter. Take it easy on us.
Can I continue?
Continue.
Okay. I was talking about electrocardiogram. It's one of the tests that we can do to assess the electrical activity of the heart. Now, it will help us to know if that individual has associated cardiac infarction, if the heart is enlarged. Also, it will also help if there are some electrolyte derangement. Of course, we can also do urine tests. A lot can be picked from urine tests. For example, presence of proteins in the urine will point to the fact that the kidney is already being affected. Blood glucose, Dr. Jimmy spoke about blood glucose the other time. Because many patients that are diabetic also could end up becoming hypertensive. Likewise, many hypertensive patients could become diabetic. So, under serum electrolyte, urea, and creatinine, we want to assess
We've lost him again. Well, I just want
because
to say
of
that,
cholesterol.
Okay. Dr. Toluni, to
So
understand
cholesterol, high
medical
cholesterol could be a problem. In fact, when you are managing patients with hypertension and they have associated,
They're not getting the flow of it, you know. They are not getting the
a lot
flow.
of people. Sorry.
Are you understanding me?
No.
No.
We just try to play along. We didn't understand the same.
It's like giving a lecture to medical students.
It's like a medical conference.
Please, can I continue?
Well,
yeah.
Continue.
Just tell us what we should not do. That's just it. And things we should do.
Okay.
Can we so look?
Okay, I think from the next slide, it will be easy to understand.
Okay, yeah, let's go to the next slide. Lifestyle modification.
Yes.
So, are we here?
Yes, we are here. Dr. Tolu, we are here. We can hear you.
Well, moderation, not total elimination of alcohol, just moderation, better.
Like a small cup like this is okay. That is what we are doing.
Juwan, don't lie. You go anymore like bell, right?
Go mistake you go to read you. We cannot hear Tolu.
We can't hear him now. That's even the basic problem. Communication
So,
gap. Network.
Let's look at lifestyle modification.
Okay.
Now, this lifestyle modification is so important for anybody that wants to prevent hypertension or anybody who has developed hypertension. Or who wants to prevent hypertension. Okay, and this is what is much more
This is insane.
Kunle. Yinka.
Ew, mo wà níbẹ̀ o.
Take it from there now.
Okay. Jao, next slide. We're talking about lifestyle modification, right? So I think from what is written down here, is talking about the role of weight loss, especially weight reduction in aiding lower blood pressure, literally. And he's talking about DASH diet. DASH diet eating plan is just talking about elimination of a lot of salt content in food. There are some food containing like bacon, it's really high content. So I've seen many nutritionists talk about alternating for Canadian bacon, for instance. So
So let's talk about the lifestyle modification, which is important for everybody. So weight reduction. Please, am I with everybody?
Yes.
Yes. For now, yes.
Am I with everybody?
Yes.
Hello?
Yes, continue.
Almost.
Joe, either Yinka or Jimmy, what is MMHG? What does that mean in terms of physical consumption? MMH, this unit of measurement.
Well, this unit of measurement is that's just talking about the SPB, the systolic blood pressure.
Okay.
So systolic blood pressure, you know, you have they will say maybe the normal range of blood pressure is 120/80. So the diastolic is the one at the bottom, which is 80. The upper one is the systolic blood pressure. So if you have your blood pressure within the range of 140/90, for instance, and you were able to lose 10 kilograms of weight, you can drop that down to like between 5 to 20. So he's just trying to show the improvement you will get if you actually lose that much weight.
Oh, that's for people with weight, Abby.
So let's talk about the lifestyle modification. Weight reduction is very, very important. In other words, people who are obese, that is when you look at your weight in kilogram divided by the scale of your height in meters. If it is more than 30 kilogram per meter scale, that is obesity. And if it is between 25 and 29.9, that is overweight. The normal body index is actually between 18.5 and 24.9. So if you can work on reducing your weight,
Wow. So he's saying that normal body index is between 18.5 and 24. If you can work on reducing your weight, so something about within that range is good. One of the things that can help you, don't let me.
Alawadani.
You want please unmute Kunle? Unmute Kunle.
Oh, sorry, yo. I'm sorry, yo. Mr. President. All
if I don't understand, it's you.
Kunle.
Yes.
Kunle,
There's a question
can you
and
please take
answer.
this presentation using your biology knowledge?
Okay.
Hello.
So if you can reduce the weight,
Somebody help us.
it is said that when when an individual reduces the weight by 10 kg, and there is possibility of controlling the blood pressure by 5 to 20 millimeter of mercury. DASH diet means dietary approach to stop hypertension.
Let's see. So with a 10 kg weight loss, you can reduce your blood pressure by that much.
Yeah.
So use the white yes to solve it.
Also, actually, I won't take that as just golden like that. There are other modalities that need to be met as well.
So moderation of alcohol has the least impact on pressure.
Do you want?
The numbers are clear. The number is right there. I didn't make the slide. So that's interesting to know.
I should be able to do this thing now. Or do I take this class?
Yes.
Take this thing now.
So you are all on top.
So my question, and Jimmy or you guys can help me with this. So when we say weight reduction, that has to do with BMI, right?
Yes. Do you want to unmute Dr. now, Jimmy?
Your child. Some of these things can be conflicting.
Raina.
Do you want please unmute Jimmy?
Oh, okay. Yeah, he's unmuted now.
Okay.
Dr. Jimmy, you are unmuted.
Dr. Jimmy, you have the floor. You have the floor.
In the absence of anybody, can I take this class, please?
Can somebody Hello.
It's not ethically okay to use somebody else's prepared slide. He worked so hard on this. Unfortunately, he's having problem with network. I will feel somehow to use somebody else's slide for presentation.
Because this has been ongoing for almost 2 hours and it cannot continue like this. So we need to decide that to round up. So, and share the slide and ask questions. People already have questions already.
Exactly. You can make it back.
We can make it a question and answer.
Just make it participatory and ask questions.
Exactly.
Dr.
So
Jim is right here, so you can just.
We have medical professionals online that can answer our questions. So if anybody have got questions, let them ask.
Lizzie is here, I'm here, and Dr. Jimmy too, and other people.
Yeah.
So let's just go ahead and do that.
Richard is there, Paula is there, Dr. Jimmy is there. You can take questions. You can take questions.
I will take all your questions.
Your name is not among the medical.
I'm a consultant now.
Sorry, guys. I don't know if you are hearing me. The greatest loss here is if we did not see this slide. if we have this slide and there's somebody that can take us through this slide, it is better off than just to be asking questions. He has done so much, put so much effort in slide together.
Okay,
if there is
I get
somebody
your
that can
point. Can Kunle quickly call him to explain to him so that we understand why someone else is taking it?
Yeah, I totally agree, Buki, because
it's like this is a lot of work.
Who is taking it? Right?
He has put so much effort in slides.
Dr. Jimmy is still muted. Please.
Cannot be muted now. I didn't mute him.
that's true. He's still muted though. Can somebody unmute him?
Yeah. Dr. Jimmy, can you hear me now?
Can you unmute Dr. Jimmy?
Yeah, he's unmuted now.
Oh, okay, okay.
This session is a little rowdy. It's unfortunate.
Wow. I will see Lenny.
Prince of Dubai, I cite you.
Abio, my business, my whole business partner.
Serious.
Oh, now.
Abina.
My whole party business partner be that.
What's your mute, Dr. Jimmy? But I can't. Why does it keep going back to being muted?
I don't know. Maybe.
Guys, Tolu has granted permission to go ahead with Jimmy, so Jimmy can continue.
What's your mute, Jimmy?
Yeah, it's showing that it's unmuted, but it keeps going back to mute. It's like
sign out and sign in back. That might help. Jimmy is trying to sign out and sign in back. Maybe that will help him to stabilize and take over.
They've shut down many aspects of life in one of the world's most
we may have to postpone this. So, okay, take home, lele, guys. Eat well, rest well, exercise, check regularly, and for those who are hypertensive, dash diet, and see your doctor.
So you said dash diet is.
Well, can we do exercise during rest hours?
What?
Yinka, you said dash diet means to reduce your salt intake. Correct?
No, well, hold on, because.
Hello?
Hello? Oh, give me a second.
Hello?
Hello?
Jimmy, you are welcome back.
Okay, I don't know, that thing kept muting me over and over again. So I just had to log out and log back in to rectify it. Okay, Yinka?
Yes?
Yeah, can we just run through this issue together? Because
let's go ahead.
It's really, yeah, Tolu is really upset about the whole thing, because hypertension to me is a very important, very, very important issue, especially in our age category. Okay, I've seen people as young as 26, 27 coming down with high blood pressure that is even quite difficult to control. So I think we really need to take a good look at this thing. It's called a silent killer for a reason.
Mm-hmm.
So, yeah.
So which slide do you want me to take you to?
So I wanted to explain what we're talking about, you know, that's diet.
Okay.
Okay,
so
great.
Actually, it's mostly a diet that is used by the Mediterranean people. It's mostly contain very, very low fat. So you're looking at plant-based diets, a lot of vegetables, you know, not strictly vegetarian diet, but a diet that contains everything that is good for the body. So you're looking at They have a bunch of sample menus that I can look at here because I use this myself too. So literally you're looking at plants that are rich in fruits, vegetables, low fat, non-fat dairy, along with peanuts, several nuts, almond nuts, beans, and so that's what he's talking about, the DASH diet. These contain very, very low carb, low purine content that will actually affect your blood pressure. So that's what that means. Did I answer your question?
Yeah. What is purine?
Purine, come on, P-U-R-N-R-I-N-E. You look at purine containing food, you know, like a food that's really, really naturally high in salt content.
Okay.
Are you saying that those ones are not good also?
ILEGSOSA.
The food with high salt content should also be avoided.
Yes. I'm not saying don't eat salt, but everything in moderation, because still you need some iodized salt. You want to avoid having issues with thyroid. So, but everything has to be in moderation.
So
Okay.
how
Hello.
do you recommend we check ourselves?
How you can check yourself?
How often? How often?
For me, it's always good to see your doctor at least twice a year. Those in very sound health. And those with hypertension already need to at least make an appointment to see the doctors every 3 months.
Every what?
Every 3 months.
Every 3 months for those who already have hypertension or are in pre-hypertensive stage. Those who does not have any concern, any health concern at all, can at least go twice a year.
Hello, can I chip in something, please?
Yeah.
Yeah.
Okay, cool. Please, I want us to look at slide 14 again, where it was talking about the classification of hypertension. Because based on each classification, your management and expected outcome varies. Now, I've had situations where people would have a blood pressure of 150/100, and they'll practically lose it and panic out. Do you understand? That is not supposed to be so. So for ease of understanding, we need to group hypertension to mild, moderate, and severe categories, okay? When somebody presents in the hospital with mild hypertension, we will place on medication sometimes you may not place on medication. Same applies for moderate. But when somebody presents with severe hypertension, you will most likely admit that person at the same time, okay? So I don't want a case or a situation where you check your blood pressure and it's mild, and somebody's telling you that, oh, you can just drop dead while walking on the road. It is not so. So you really need to know where we fall in. Now, also, if you look at that table, we have normal and we have high of normal. High of normal is like pre-hypertension. Pre-hypertension is like, okay, right now at the moment, you are not yet hypertensive, but with the way things are going, in the next 6 months, 1 year or 2 years, you will most likely be hypertensive. Just like last week, we were talking about pre-diabetic and being diabetic. So even at that stage, it is even the best time for someone to apply all the lifestyle adjustment. You won't place the person on medication, yes, but you need to apply lifestyle adjustment. Now, also, if you have measured your blood pressure and you found it in the range of the mild hypertension, that's between a systolic is the upper value of 140 to 159, okay? Based on several factors, you may be placed on medications, or you may just know that, you know what, go and rest, go and relax, and let's check this thing back, you know, after a week. Because sometimes you need to check your blood pressure like 2 or 3 times with a certain interval apart before we can conclude that, yes, you are hypertensive. Because of stress, certain difficult situation, time of the day, emotional issue, based on what you're going through, someone might present with a seemingly high blood pressure and may come 3-4 days later and the blood pressure is perfectly normal. And someone might be what we call white coat hypertension. The moment he smells or she or she smells the hospital premises and see the doctor and the nurse's face, the blood pressure goes up. And you must also realize that from time to time on a daily basis, our blood pressure varies. I'll give an example. Let's say I wake up with 120/80. During the course of the day, I could have a plus or minus 20 to my 120 based on the activity I'm involved in. Okay? If I do a lot of hard work, if I sweat and I'm dehydrated, it may go lower. If I bleed or lose some blood, it may go lower. If I'm really panicky or going through a lot of stress, like Lagos traffic stress, it might go higher. Do you understand? But within a certain limit. And that is why whenever you want to check your blood pressure, they'll tell you, sit down first of all and rest for like 30 minutes, let us check. So it's very good for you to know which category you fall into. Because I've had situations where people would have an elevated or a mild blood pressure and they will practically lose it, like, my BP is very, very, very high. It is not very, very high. It is high, but it can be controlled. Do you get my point?
Yes.
Yes. Good. Okay, very good. Any question? Any question?
Okay, can you please touch those symptoms again? Like, I know he
So
touched.
is somebody asking questions?
Yes.
Okay, what was the question?
Symptoms, like real symptoms. No, what slide you mean?
Okay. Now, first of all, J1, hello. You don't wait for symptoms when it comes to hypertension. It is primarily not a disease that has symptoms. So we can't wait or act. Not that you don't have symptoms, but this is it. A lot of people have high blood pressure and they are going about their everyday life. They don't have symptoms. Okay. As at the time you have symptoms, there's a good possibility that person already has complications. As at that point in time. Okay. So we don't want to base the fact that, oh, there's symptom. One could have headache from high blood pressure. You could have headache for so many other reasons. Do you get my point, J1?
Get headache from stress.
Yeah, so don't let us wait or seek for symptoms when it comes to this thing. And you must also realize that 80% of sudden death come from high blood pressure issues. Whenever people are talking about, pardon?
Sorry, can I quickly chip in something before you continue? It's part of the J1's question,
yes.
Right?
Yes, please.
Since we don't need to wait for symptoms, right? And are you suggesting that we actually check as regularly as we can, at least to detect it when it comes? Because without symptoms, there is no way you can know where you're already in danger.
Okay, this is it. Now, they say this thing, there are 3 numbers everybody should know, symptom or no symptom. At every point in time, you must know your blood pressure, you must know your blood sugar, and you must know your blood cholesterol. Don't wait for symptoms. We see what we're trying to do is preventive medicine, not curative medicine. That's why we're having this talk. Okay. What it means is that you should have at least checked your blood pressure in the last, just like Yinka said, at least in the last 6 months. Okay. The moment you are not doing that at all, you've messed up the whole reason. Because we are supposed to catch this thing before. If anybody will be hypertensive, it's best you even catch it at the level of pre-hypertension. That means you have a BP of between 130 to 139 for the upper value, which is the systolic. So don't let us have that habit of we're waiting for symptoms. No, we should be at the level of I checked it recently. Okay. If perhaps you have symptoms, you understand, we have headache, you have palpitation, you have angina, which is like chest pain, which is like a mild form of heart attack. Yes, we don't want to wait for that. We want to be in the category of those who have actually checked this thing recently. Do you get my point?
So
Yes.
Dr. Jimmy, you said blood pressure, blood sugar, and what's the last one?
Cholesterol, blood cholesterol.
Okay.
Dr. Jimmy, one thing I want to stress also is that as we are all above 40 years old, this is supposed to actually be a primary thing that is monitored by your primary doctor. For example,
yes.
What is called hemoglobin A1C, that detects how your blood sugar has been running for 3 months prior. Right, Dr. Jimmy? So that way it's able to know that, okay, this is going on, you need to work on this. Then regularly, they check your blood pressure. You do other blood tests too, like your complete metabolic panel, your complete blood counts, your thyroid, especially women. Some are just getting fat and they don't understand why. They diet, they exercise, but they have issues with their thyroid hormone. And all these things happen because they are messed up. And the only way you know is going to do all these tests. That is very, very important. So all these, we cannot say, oh no, we are not taking care of these aspects at all. So primary prevention is the key here, guys.
Okay.
You mentioned something, a that's an issue because I don't understand it.
What?
Meglo what?
Hemoglobin.
No, I mentioned it last week. HbA1c.
It's just to check your blood, and you just check the sugar
blood sugar
content in your blood, but you can check it for over 3 months.
Okay, I was thinking it's another form of ailment. No, Allah.
Okay.
Now what?
This guy is.
So can somebody have low blood pressure, Dr. Jimmy?
Yes.
Okay. The concept of low blood pressure, now this is it. Low blood pressure is symptomatic. That means there will be symptoms for low blood pressure. And the concept of blood pressure is funny. Now, someone like you now, your BP might be 170 steady, day in, day out. Your physique now, we know now. You could be 170 day in, day out. You understand? Now, if my BP runs between 120/80 or 120/70, if for any reason, let's say I go to donate a pint of blood, or I'm really dehydrated, maybe I've been stooling for days and I'm really weak, my BP will go down to 900/70. I will be feeling dizzy at that level. Do you understand? I won't be able to cope with what you have as a normal blood pressure because my system is accustomed to 120/70 or 120/80. Okay, so low blood pressure is symptomatic. Now, low blood pressure is dangerous in its own way, and there are reasons for low blood pressure. For example, people who have high blood pressure, if they don't properly regulate their drugs, okay, maybe the dose they had, they overreacted to it, or they continued for so long, or the dose should have been adjusted, it was not adjusted, their BP will crash. You hear like, okay, those are signs of low blood pressure, dizziness, especially dizziness, inability to stand straight, and some other, even to sit up straight sometimes might be a problem. And for those people with low blood pressure, the best position for them to lie down flat, supine position. That way the heart's able to, they will be able to cope better than them sitting up or standing up. And there's always a reason for low blood pressure. And the reason can be very, very broad, very, very wide.
Yeah.
It could be very, very wide reasons. It could be septic shock would lead to hypovolemia, dehydration, gastroenteritis. Even when somebody has a stroke from high blood pressure, it might get to a point where it now crashes to low blood pressure, and you need to intervene by raising the blood pressure back. So yes, people can have low blood pressure. Unlike high blood pressure, hypertension, low blood pressure has symptoms. The dizziness is very, 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 very problematic, and it can be corrected either by transfusing blood or transfusing all these drip fluids.
Mostly,
yes.
Actually, another thing, it's actually very common in elderly too. If they are not, they need to be prompted to drink more water, and they have a declined ADL function. So it's very, very common in elderly patients.
Please, I have a question. Hello, Dr. Jimmy.
Yes, President.
Yeah, so my question is around the two values of when you take measurement of your blood pressure. So there is the upper one and the lower one. I just want an explanation of what is responsible for each of these values, which one is very critical to watch out for.
Okay, even in medicine over time, we choose different ones at different points in time. There was a time the teaching was like the lower value is more important. There was a time they said that the teaching says that the upper value is more important. And even more another issue is that the difference between the two of them is even very, very important, even up till now. That means that if you subtract the upper one from the lower one, the value you have in between two is important. But if you understand one thing, for most people, the difference between 20 or 30, if the lower is 80, upper might be 120, that's the difference of 30. If your upper is 150, your lower might be 100, 110, or 120, okay? So they usually move together in tandem. Not in all cases. Sometimes the upper value might be 180, lower value might be 100. Okay, that is another realm, that's another set of issues, signs of certain damage along the line. But I think what for the reason of ease of monitoring, I think it's best everybody just focus on the upper value only for now. Okay, so that we won't confuse ourselves. Just focus on the upper value. What is your upper value saying? Okay, at every point in time. And if you are using a digital SFIG, it's people have actually had issues with digital SFIG than the value that they give. The SFIG is not yet perfect, but it's very fantastic for monitoring. Okay, so and one thing about healthcare these days is that we want the patient to be involved. So equipment that allow you to monitor your BP from home, check your blood sugar from home, be able to do all those things are very, very important. So if anybody has had history of hypertension, had issues with hypertension, you should have your own SFIG in the house and be able to record your data that you get on a daily basis. Sometimes you may need to check it 2-3 times. Always take note to make sure you place the cuff appropriately as instructed. Because if it's not properly placed, your results will not be anyhow result though. So place it properly, check the value 2 or 3 times, preferably best check in the morning. Okay, you shouldn't come back in after 2 hours in Lagos traffic and check your BP, and you want to also make decision on that. No, first thing you wake up in the morning, let's see the baseline level first of all. So from that baseline, you can now determine that worst case, bad, you know, if you do +20 on the systolic during the course of the day. So like I said earlier, for the ease of monitoring and for clarity, because numbers can make you feel dizzy sometimes, just focus on the upper level.
Okay, another question, please. So you just spoke about the electronic one that individuals can use to monitor personally at home.
Yes.
And then, if I heard you correctly, the result might not be exact as what you will get from the manuals that doctors use in the.
That's true.
What is the margin of error, so that at least one can get some level of comfort to know the accuracy?
Actually, it depends on how you position yourself when you're using it. You have one digital one that is a wrist cuff, for example, the wrist one. So it's always advisable to sit up and place your hand flat on the table beside you when you're using that. So ensure that you relax, or else it can just give you a false eye reading.
I'm done.
Yes. Also, in addition to that, sometimes I do tell people that if you have a new SFIG, okay, you could take it to your primary care physician, let them use the manual to check it right there, and let us use the digital also right there. You understand? So if you note any margin of error, you can note it immediately. Let's say I check it with the manual and I get 140/90, and I check it with the digital and I get 150/100. I'm saying margin of 10. And you must also realize that digital one, that if you check it 2 or 3 times over and over, the value may change. The reason why, I don't know. Sometimes I think it's maybe because the first one, people are a bit anxious. Eventually, you're a bit calmer. Maybe it's the machine just getting itself right. But I always support checking multiple times. Okay. But if you have a machine, check it out. Check it with your what's it called? Take it to your physician. Have a check of both at that time, and you'll be fine. And for people who have issues with having phobia whenever they're in the hospital, anxiety setting once you see the nurse or the doctor or the smell of the hospital, the digital one is very fantastic. You are in the comfort of your house. Nothing will make you panic. Nothing will elevate your blood pressure, and you have a fantastic reading.
Okay. Another question I have. It's about some of the things we can do to address this hypertension issue. One of them, as we saw in the slide, is physical activity. Now, we all know that it might not be very easy for people, especially in the city, where you barely have the time to even wake up for breakfast before you go to work, and then you come back at night, especially in a place like Lagos. And the only time you have is Saturdays and Sundays, where there are other commitments, social events, and all. So that physical activity part might be very challenging. Are there things that could be done that can serve as substitute for physical activity, or are there some sort of physical activities that are recommended in situations I just described? Because we don't, I mean, some of us have treadmills, we don't even mount it.
Actually, the word has made things so simple that you don't have to hit the gym all the time. For example, COVID has already taught us that we have almost everything shut down. So even several YouTube videos that you can watch and do exercises at home.
Where's the time, Nika?
It's true.
Yeah. And in addition to that, one thing we must also realize that you see in the last 10 to 15 years, there's been a lot more awareness about physical fitness. 15 years in Lagos, I don't think people exercise this much as they do now. A lot of people go out jogging. There are people that go out jogging in groups. Sometimes, you know, it's, especially if you're not a sport-inclined person from your youth, it's going to be a huge challenge trying to start doing sports or jogging at this point in time. So you might need a group help or group effort. You can have group help online. You can have group help in your community. You can have it online where people meet online to, you know, do Zumba, they do workout, they do a lot of things. So people use dance to achieve the workout. Some people are just so self-motivated, they can work out anyhow, anytime. I know some people in this group that can work out anytime, any day. So I think whatever works for you, you should try and experiment where you can get results from. It's the most important thing. Getting the result is the most important thing. If you need to meet with people online, if after COVID, if you have to join a community group or join a group just to kickstart the effort, fantastic. Now, for the regular working class person who wants to set out from the house as early as 7 a.m. in the morning, and you may not get back till like, say, 7 p.m. in the evening,
10 p.m.
It's going to be, I'm considering people in Akure and Abuja.
No problem, I can talk. What's the excuse here?
You know, it's how do I explain it? It's kind of difficult for us to say we want to work out, because in the morning you are in your car, from your car you are in the office, from the office you drive back, and you unless possible, some people, the only exercise they have is sex, and the only reason why they begin to know that I'm not fit like before is actually when they have issues with sex. That's when they begin to complain of physical fitness issues, that I need to work out more. It wasn't like this before. So everyone must just, we must carry out, we must be intentional about trying to get results when it comes to physical fitness. It won't happen by chance. Especially if you were people like my dad used to say, you were never involved in any sport in high school. So it runs that way basically. I hope that answers your question.
Yeah, it does. I think we just need to really pay attention to it, because even the sex part too, they have also said that this thing can cause erectile dysfunction. So when you don't exercise,
I know you are afraid.
The sex that you are counting on, you have erectile dysfunction. How do you now survive?
Are you afraid? Are you telling us your fears?
You protecting your own securities.
No. So no, but Jimmy, you know that my role, I need to express some silent members. Some of the things they are not saying that they are telling me personal chat.
Yeah, alcohol also contribute to that.
Juwon just ends.
It's a lie. Is there moderate? Is there moderate? Is there we not? It not eliminate it. I read that slide now.
You know, all these medical practitioners can kill someone silently, sir, with their
all these things that Juwon is even drinking, we are not sure.
Don't take alcohol. Don't
take alcohol.
No.
Don't wake up like Juwon and drink alcohol first thing in the morning.
Don't drink alcohol. Do you know the number of jobs that will be lost?
Sunday has a question. Let's listen.
Please,
Sunday
I have an important question, please.
Sorry.
Okay.
In the slide, why Juwon was sharing the slide, I think I saw something on coffee. I take coffee a lot. What's the relationship between that and hypertension?
I saw, yeah, right here.
Now, okay, let me break it down simply. I don't know how to say it. Let me break it down simply. Coffee has what we call caffeine, and caffeine can keep you hyper. Caffeine can. I take coffee too. If I don't want to sleep, if I want to keep awake, if I want to be alert. Now, all this alert awake issue contribute to an elevated blood pressure. Okay. Over time, if you, I don't know, Yinka, can you help me out here? I'm lost. I know what I want to say. I just don't have the words for it.
I talk about this all the time in psychology. Well, in psychiatry, you're looking at 5 neurotransmitters in the brain that's actually affected. Okay, let me break it down. Coffee is a stimulant. You understand what I mean by stimulant? It stimulates parts of your neurotransmitters in the brain anyway. So because of that, it can actually raise your blood pressure momentarily. Now, if you're drinking a lot of coffee, that is where it's bad. If you're drinking maybe like a cup or 2 during the daytime when you need it, maybe to stay focused, that's acceptable. But some people go ahead and take coffee even in the evening. Some may even finish 2 pots before the day goes on. Then, you know what happened? They have issues with insomnia. They can't sleep. Then they have to wake up in the morning to work. So you're looking at a lot of mental stress. Over time, that affects your physical being. And it's also have a very long-lasting effect on your blood pressure.
So please,
Dr. Jimmy.
Sorry, I still want to continue. Maybe I'm directing this to Rachel. So if I take like 5 cups of coffee during the day, and when I get home, I sleep.
5 cups, City Boju, my brother.
No. Rachel, he said that because this thing applies to me too, to be honest. I take a lot of coffee, but I sleep, and I can sleep within 2 minutes of getting to bed. It has never been an issue for me. Now, if the issue is that coffee keeps you awake, which I understand can become an health issue. If it doesn't give you insomnia, is it still an issue?
It is, because now your neurotransmitter has been fed coffee and they are already used to it.
Break it down now. Which one is Noro again?
Okay, the neurotransmitters in the brain are your norepinephrine, okay, now you're going to want me to break it down. I don't have alternative word for this mudu in your brain. So the thing is that when they get used to this, you're addicted to it. So that means you want more. Before you know it, you take 6 cups, then it goes to 7. You won't feel the effect, then you go to 8. That's where it's dangerous.
For instance.
So if I'm taking it not to, I take coffee to beat cold most of the time. I'm not taking it to keep me awake, and I don't really feel it.
Yeah, I was like you when I first got here. So what I did to change that is I changed to tea. And also there are coffee that's actually decaf. So you can change to decaffeinated beverage. You can change to tea.
I even learned that decaf is worse from people that take coffee.
Hey, they are saying it's worse because they want the real thing. No mind them.
Can I ask my question now, please?
I want to hear you. Welcome.
Hello.
You can't hear.
Can I ask my question now, please?
Yes, Ogashadu.
Dr. Jimmy, I don't know if this is a myth or something, but about people who are on drug for hypertension says it causes erection problem. How far that is that true?
Sorry, your question again.
I said I've seen people that are on hypertensive drugs, hypertension drugs, people that are on drugs. I've seen men say it causes erection problem. Is that true?
Okay.
Sorry,
Jerry.
You are addressing the question to Dr. Jimmy. Where is Dr.
Jimmy? Yes, I want to know if it is a myth.
Can you hear me?
I can hear you now. Yes.
Sorry, they are doing naming ceremony beside me here, so there's noise from there.
Inside COVID.
Inside this COVID, wahala.
They are doing it though.
So do you understand my question?
Yes, I do. I understand you clearly. Now, this is it. There's only one drug, Ogunkanpere, that has that side effect commonly. Okay? And now, the issue of side effect, it is not even everybody that will have side effects. Okay, I'll give you a good example. There's a drug we use for blood pressure. It on the broad category, we call it ACE inhibitor.
Mm-hmm.
We've lost Jimmy.
No. Sorry, a call came in. I'm on the phone. A call came in. Now, about 20% of the population will have dry cough when they use lisinopril. Not everybody will have dry cough from lisinopril. So you have to take them off that drug to another thing. Some people would use Aldomet or Modureti, one of those two. And 3-4 months down the line, they will complain of Kintanwiyo Didemo. But it is not all BP drugs, Lomanfa, and there's so many drugs, you can easily switch from one to the other.
Yes.
Your switch can be based on complication, it can be based on side effects, it can even be based on the cost. If you feel one drug is too expensive, you can get a cheaper one that will still deliver and do the same job. It can even be based on the result of your baseline investigations. If we feel that something is wrong with your baseline investigations that need to be reversed, then that will determine the choice of drug that you'll be using. So it is wrong that to say that BP drug causes it. Only one drug can cause it. And even that one drug can't cause it for everybody.
Yeah, Dr. Jim.
Yes, ma'am.
What about the group of beta blockers, especially the whole generation one, like the propranolol?
The propranolol
has a lot of effect on the parasympathetic nerves, and that can actually cause erectile dysfunction in some.
Okay, the first problem with that category of drug is that people who are diabetic or who are asthmatic should not even use propranolol. It's a broad beta blocker. It's not selective. Someone like atenolol is more selective. Atenolol is an alpha-1 beta blocker. So it will give issues for people in that category. It doesn't block everything. For example, now, if somebody who is diabetic takes propranolol, it blocks glycogenolysis. So whenever they don't eat and the liver is supposed to supply glucose, that thing is cut off. You understand? So if you have a selective blocker, you are safer than using a wide beta blocker like propranolol.
Please, I have a question now.
So who is that? So should be able to suggest, Jimmy and Inka, so you can now suggest that, okay, for people that are prone to erectile dysfunction, these are the kind of medication they can use to treat their hypertension. Or is it all medication that treats hypertension or that can have that side effect?
No, actually, let me correct this. It's not everyone that will develop the same side effect to medication.
Okay.
For example, if my doctor gave me a group of ACE inhibitor, like maybe I'm taking lisinopril, and some people have dry cough as a side effect, it doesn't mean that I will have side effect like that. But it's our responsibility when we get a prescription and we start taking it and we notice something different, like we're experiencing any side effects, we need to let the doctor know that, okay, this has happened with this medication. What do we need to do? Then the doctor will use his own medical knowledge and discretion to switch you to something else. So it's not a blanket fit-all side effects. Not everyone develops side effects. Some may not even tolerate lisinopril or any ACE inhibitor meds and do well on different medication like even beta blocker or atenolol or any other group. Right, Dr. Jim?
Yeah, please, I have a question, moderator.
Stop.
We lost 1 hour. Juwan, we lost 1 hour. We didn't start at 4.
Oh, Tony.
Okay, Chalo, you have a question.
I have a question.
This presentation.
This is very important, especially the ones that causes erectile dysfunction. Hypertension.
No, side effects when they
I understand you. I understand you.
Debo is asking a question. Troublesome Ogade.
Ah, Ogade is reversible.
Because don't do me here now.
Debo is asking a question.
Oh, that's okay, please. Yeah, Dr. Jimmy and Yinka, please, I have a question. Yeah, I have someone close to me. You know, he has been on this hypertension medication for a while. Let me just say for like 3 to 4 years now. It always go up, go down. And then to extend that now, they are suggesting maybe you should go on a herbal, like all this herbal treatment just to resolve this stuff. I don't know. Is it possible to be cured at once or because I've just fed up about it?
Hello. Now, first of all, this idea of is going up, is going down, is going up, is going down. It's a sign of poor BP control, and it's not good. Now, from my experience with patients, some people are not truthful about how they use their drugs. In reality, women are even more compliant and adherent to drug use more than men. So if they are telling me that their BP is up and down, their BP is up and down, it's if they've not been using their drugs regularly, most likely, and they've not been seeing their doctor regularly. So it is not a hopeless situation. Hypertension does not have a cure, but it has a management protocol in which you can actually be on medications for life, and it can be well controlled throughout life. Now, those that are suggesting that they should go for herbal, I rebuke them in Jesus' name. It is one of the greatest scams I have seen in this part of the world. JNLD,
All these they will just take your money. Remember Dr. Abalaka and his cure claim for AIDS.
So, so you understand, it is not, these things are, one thing about science and about market is evidence. This is evidence-based medicine. If there's evidence, there's no controversy. There's no kalokabo, there's no story for the gods. If your stuff is working, gather 2,000 people with hypertension, give them, call people around, let us see the results all together. You understand? Most herbal are liars. Now, there's herbal medicine that works. I don't disagree. But for us to get there, they would have done their research adequately. The ones outside saying that they can claim, they can do this, they can do that. We don't even know what they are mixing.
Yes, so.
You understand? So please, the idea that they switch to herbal is asking for that person's obituary. Because hypertension is serious, is a serious issue. And I think it's too risky for someone to say that this one is not working, switch to herbal. Herbal will work. No. If herbal will work, let's have evidence to it. Don't just come and claim it to work and they abandon what was working. And for that person needs close monitoring. Let a family member monitor the BP along with the person involved. Let them monitor the drug use. Let them monitor their clinic visit. If all this is monitored, I am sure you won't have a situation of it's going up, it's going down, it's going up, it's going down. Also, you must realize that your BP can't be stable
Jimmy,
one day.
what time of the day?
Yep.
What time of the day is he monitoring this blood pressure too? You know,
Okay, the best time to
like,
monitor
are they
it.
monitoring it every day around the same time every day? Yeah, what time of the day? When are they monitoring it? What event happens before it's monitored? Did he just run a marathon when he checked his blood pressure, or what happened?
So all those things have to be dealt with before you can conclude that the orthodox drug didn't work.
Can they see? Please, I have a question.
Dr. Jimmy, please.
I have a question.
Dr.
My question
Jimmy,
is
please.
around coffee, the intake of coffee. So I understand the explanation you guys have given us. Thank you. But I also know that for the purpose of agility, some people also use energy drink. So if it's just about me staying alert, being agile, which is safer to consume, energy drink or coffee?
The issue is there's been a lot of controversy around energy drink, the health hazard and implications of that also. So I won't vote for any one of them. And you must also realize that the two of them, there's a strong tendency to abuse either of the two. Energy drinks can be abused, coffee can be abused, especially if you're a workaholic and if you live in the city. So it's safer. I can't vouch for any one of them. In fact, I think it's even a faulty lifestyle. I take coffee too, you understand? But I think it's a faulty lifestyle to be dependent on coffee and energy drink for daily, daily motivation or daily energy. I think it's faulty to depend on any of those two. It should be a once in a while thing, not a daily thing.
Okay, thank you.
So,
please, on the drugs.
Mental health topics. I thought we were going to address mental health also.
Please, I want to speak on the drugs, please.
Plan for mental health today.
No,
hello.
Yeah.
Hello.
Please, on the drugs. If someone is taking the drugs regularly, what I've seen in people that take drugs is a complaint that they can actually go into hypo. What do you have to say about that? Like someone who is checking, is on drugs, he checks, it goes back to 160. Some people go to 90-60, they stop the drug, then they keep on monitoring. They keep on monitoring. When they see it shooting up again, like 120, 130, they start the drug again. What do you want to say about that?
Okay, I mentioned this thing earlier.
Wait. Sometimes I think I read some things on internet. I had to go and do ECG. The doctor told me, gave me some drugs, and by the time I got back to the doctor, I was having 160. That was like a year ago, and ever since then I've stopped taking the drugs. So people I know talk about when they use the drug regularly for like every day in the month, they go back to like 90, 60, 160. Most people are afraid they can go into hypo.
Okay, now let me comment on that. I mentioned something about that earlier. You see, if I see somebody for the first time, a young man, 3-year-old, came in with a blood pressure of 150/100, has history of recent stress, has not been sleeping well, I will not place him on BP medication.
Thank you.
You understand? I will not place him on BP medication. He has to go and correct all those issues that is disturbing him at that point in time. And that is why it's very important for us to classify BP as mild, moderate, and severe. So then some other people who are like severe high blood pressure, when you give them a drug, it's best that within 3 days, 5 days, they go back to the clinic because people respond to drugs in different ways. At the same time also, some people can start with 10 milligrams. As time goes by, with good control, their drug will be adjusted down to 5 milligrams. Later on, it can go down to 2.5 milligrams. You can only achieve this if you're in touch with your doctor. You understand? And if the doctor has taken time to explain to you that, ma, sir, if at any point in time, teba jila ro, teba di dro to yiba koyin, e ma logun lojo yan, e mu wa keje ka adjust the dose. So as time goes by, it's not like titration or titer. We need to keep adjusting that dose to the point that it's okay for that person. It could be 2.5 milligram per day. You understand? Like in your own case now, I think they should have waited. Like I said, the ideal thing for BP diagnosis is 2 or 3 incidents of high blood pressure apart, especially when there's no trauma or stress or history of bad sleep around that person. Then you can diagnose hypertension. Do you get my point? Yes,
I guess I understand you.
Dr. Jimmy, can you elaborate on what can be done when someone is around that mild or moderate stage that doesn't require medication? We need to know that too, I think.
Okay. Now, high blood pressure is placing somebody on high blood pressure drug. The fear most people have is that I'm going to be on drugs for life. So, as a physician, I consider that I'm giving this person a sentence. I'm not always eager, especially in case of mild and moderate hypertension, to place young people on drugs. If it's a 60-year-old person or 65-year-old person with moderate hypertension, I can't place them on drugs. But if I say 40-year-old, 45-year-old with mild or moderate, we need to give them room for lifestyle adjustment to work. Tell them, see, your sleep pattern is bad, improve it. See, you're on the big side, try and lose some weight. Or see, the way you manage your daily stress is poor. You need to improve on it. We must also give room for lifestyle adjustments to have an effect. If the person presents any form of results, like somebody is like 160 and I'm suspecting some form of heart damage, or the heart is enlarged when we do the baseline screening, or the kidney has some abnormal value, liver abnormal value, because of that, I'll tell the person, let's place you on drugs for a while until we have a better blood result. Then we go back to seeing if lifestyle adjustment can be of help. So in the absence of any abnormal blood results, okay, mild or moderate, you may not necessarily place them on BP medication. You could just place them on sleep medication, tell them to reduce their salt intake to low salt, not low salt intake, okay? Correct diet, stop eating in between meals, stick to basic diet, morning and breakfast, lunch, dinner, avoid soft drinks, improve your exercise and physical activity level. Within 3 to 6 months of lifestyle adjustments, they should begin to see changes. So it's not everybody that has this high blood pressure that will be on drug. Some people, lifestyle adjustment only will suffice and they will be fine.
Thank you.
Sorry, are you saying no soft drink at all?
Oh dear.
Why should you be defending soft drink at 40 plus?
The one that just spoke about the function. You still want to be taking
So I should be taking NAC all the time, right? Jack
No.
Daniel all the
So there's
time.
a conspiracy.
No.
Listen. Hello, let me come in.
Alcohol and soft drink.
It will cause erectile dysfunction.
Hello.
Alcohol doesn't cause.
Alcohol and soft drinks. Both of them can be abused. And at our age, I don't think soft drink would once in a while, yes. Like I never go for absolute. I'll never say lie, don't ever do this again. No.
Absolute vodka.
What
I mean, absolute
When I say I won't go for absolute, what I mean is that I'll never say my ever moko come on lie. Don't ever take Sprite again. You understand? Don't ever take alcohol again. We don't go for absolute. Go for moderation.
Okay, so please, I have a question. I have a question. Dr. Jimmy, you are a man like me. You are a man like me.
No, he's a woman.
How do you enjoy life? Don't drink alcohol. Don't drink soft drink. Should we be swallowing our spit alone? People say life begin at 40. At 40 now, you guys are giving us regulation. Little salt, no meat, no this, no that, no power. What do you want us?
Moderation is the key.
No alcohol. Very soon now you say we should even waiting.
This is only erectile dysfunction. Erectile dysfunction. Power.
Gbogbo ele tó ṣe níléeṣẹ́ grammar school. The time yóò ti tó ẹ.
What is the life?
Okay, see, Presido, you know, I will never tell you.
As a guy,
in fact,
Jimmy, as a guy, please.
See, thank God, pay. Ọlọ́run ṣe pé ọdún ẹ̀ mo ti mẹ́mú jọ sí. Presido, thank God say ọdún ẹ̀ mo ti mẹ́mú jọ sí. The fact is this.
Àṣírí tú.
Jimmy, you know, sometimes in the morning, when we don't have time to take breakfast, after working for some hours, our glucose will drop. I don't think taking a bottle of Coke at that time is bad.
It's not.
No, it is not now. See, like I said,
Coke to replace breakfast.
Like I said.
Is
that glucose in NSC too?
Hello.
Hello. Can I speak, please?
Okay.
Hello, Jimmy.
Like I said, it's always the best to. Okay, for example, you know, answer on Jen last time. Stick to your breakfast. Understand? Try to avoid that in between. It's still the best of diets. Do you get my point? Now, when you are going to rely, okay, maybe you are traveling and you don't want to eat where you are, and you've not eaten for a while, you could take a bottle of soft drink. There's nothing wrong with that. You are in transit. It's a temporary situation. There's no problem with that at all. Even in the case of work, I don't tell people what I'm not giving you a solution for. For most men who drink, you can't tell them to totally eliminate. It's only when I know people that have
only alcohol in sir.
Hello.
Palm wine, alcohol in.
Hello.
Okay.
Jimmy.
Yeah.
Hello, Jimmy. Can you hear me?
Yeah.
Hello, Jimmy.
I can hear you.
Sorry, this is Wale Dari.
I can hear you.
Sorry, please. I have a question, please. Yeah, sorry. For me, I don't drink, but I take soft drinks. So, hello, Jimmy, can you hear me?
I can hear you clearly.
Okay, now, sorry. What I'm saying is for me as a person, I don't drink alcohol. I don't take alcohol, rather, but I do take soft drinks. At times, I don't eat like that, but whenever I decided to eat, I may take soft drink and I go to work. So now, when you are saying when somebody is above 40, somebody should reduce the Coke content. So I'm looking at, does it really have any serious adverse effect on my body? Hello?
Now, hello, can you hear me?
Yep, I can hear you.
Now, two things. Number one, most of the time, the people that have a problem with Coke are those that take it too often. You understand?
Yeah.
Now, the second thing is this. The problem we have with Coke, can you hear me clearly?
I can hear you.
Okay.
Can you please define too often?
Is the network okay?
I'm with you, Jimmy.
Okay. Now, for someone like you, I would still encourage you to have a proper meal rather than rely on refined sugar.
Okay.
Now, it may or may not affect you. There's no absolute. And sometimes the rule is to each man his own. But it's always the best to be on the safe side in the sense that, see, it's better for you to drink pap in the morning than take a bottle of sugar. because your bottle of sugar is refined already to flood your bloodstream. Half on the other side will take a little while. It will be broken down gradually, and the body can, the pancreas can accommodate such, such intake of sugar, glucose or carbohydrates. So as we get older, the fact of, oh, I'm taking soft drink should not be a staple. It should not be a regular thing for us.
Okay.
I don't know if you get my point.
Yes, I get your point. Yes,
Once
you're
in
right.
a while, yes, but it should not be a regular thing. Rather, go ahead and stick to regular meals rather than find yourself taking refined sugar.
Yes.
Okay. Thanks so much. Yeah.
Yeah. Any further consulting questions, please see Adeju.
Yes, I have a final one. I have a final one on erectile dysfunction.
This Kule is not serious.
This is not a go.
You joined prayer meeting this morning. I think you have changed.
Why is everybody?
I was actually
Why is everybody so excited?
Doctors are not speaking on erectile dysfunction today.
Why
Please, let's
is
leave that for
everybody
another day.
so excited? Why is everybody so excited? Okay, so this is my question. Dr. J.
Yeah, you changed. You changed your way.
You guys allow me to ask my question now. You don't want me to understand? Okay. All factors held constant. All factors held constant. Now, said that, okay, we also know that our level of agility.
Yeah, we're all tired, baby.
reduces.
I can't hear your question. Your question is very important.
The question now is that, so to checkmate this, or to avoid or mitigate against erectile dysfunction, there are all sorts of things that you see that are being sold, particularly in this part of the world. Okay, so we have some bitter drinks, which in some clients they are administered as medicinal. So we also run away from this. For instance, like one year who doesn't drink alcohol. Maybe one day gets to a place and the guy says, "Oh, I have this bitter." Should we flee from such drink because that will help us our sexual performance? Please.
All right.
Come again, Kule. Hear what you were saying. I didn't hear it clearly.
Can you come again?
Let me come again, but I don't come in public.
If you cannot come again, then you already had that issue.
Okay, let me take my question again. Let me take my question again. The question is that all things held constant. This is not a case of high blood pressure. But we know that with age, you have to reduce alcohol intake, you have to reduce all sorts of things that you have highlighted. I'm saying that in this part of the world where certain bitter products are sold, and some of these bitter products are made of, or they have alcohol content, or you even go to some place, they give you agbo. No, agbo is common in this part, you know. They give you agbo, and for the agbo to be potent, they soak it with gin, as an example. Should we also avoid such completely because of what you have just told us now?
Okay. Okay, this is it. What I've said never said don't take alcohol. Hello? No, I'm coming. So now the issue is this: if you are taking alcohol at a medicinal level, that alcohol is tiny. You can't compare it to the alcohol you take for consumption when you're having a leisure time.
Yes.
So if I'm being told to, if you look at the quantity, and you must also realize that it's about risk-benefit analysis. Okay. If the agbo can truly cure something, you understand? If the agbo can truly cure something, that is a benefit. Analyze it with the risk of taking alcohol That
So,
amount
so
of work is very, very small.
Can you see people?
I'm seeing you and all the people.
See you.
Can you see
Now, also
see
understand one thing. Understand one thing
Yes.
is this. My problem with Agbo is that not all plants are medicinal. Some plants are toxic.
Leave that thing.
Some mushrooms are toxic. Some plants are toxic. You understand?
Even,
Plants are
even
toxic.
if it is medicine,
And sometimes don't know which are
with a measurement.
Measurement. The sellers are not educated.
No, in this case.
Okay.
They use their gut to gauge it.
That's even dangerous.
They are experts now. They are shadow medical.
I think at this point
we need to go.
Direct our further questions to the group
I
chat.
think we have done enough.
As you can see, Doroji is tired.
For you.
You guys tired.
I'm hungry. And I don't miss my food.
Sorry about the initial hiccups we had today. Thank you all for joining in. Let's see you. So, Mr. President.
Thank you very much, guys.
Bye. Nice seeing you all.
Bye.
Okay, bye.
Bye.
Bye. Yeah.